So for our exercise progression for our patient, we decided to work on CARS. Specifically, we're going to work on positional joint isolations of CARS level 2. And we chose to do this because with the CARS, we're going to be stimulating those type 2 mechanoreceptors, which are going to be working to create those cortical action maps. So with this, we're looking to see how well the knee can move independently from the hip and the ankle. So what we have Kevin in this position, mocking as our patient, and we have him seated so his lumbar spine is blocked out from the wall, and what he's going to be doing is also holding his hips. So we're going to be using his right leg. So his hands are going to be supporting his hips, so the hips locked out. And as we're going to be doing this CAR, and we're going to instruct Kevin to make sure that his ankle is neutral and it's not either pointing up or pointing down. So Kevin, to do this motion, there's four different motions we're going to go through. There's 4 total transitions we're going to have to go through to reach 4 different positions. So the first one, Kevin, is I want you to just focus on your shin, and you're going to try and focus on turning it outward, externally rotating. Good. So that's transition 1. We're looking to see what the quality of that movement is and if he reaches the first position. So for the second, we're going to look at the second transition, which is, Kevin, I'm just going to have you try and extend your knee all the way up you can, maintaining that external rotation. Good. Again, we're checking to see if the position is obtained and how great the transition was. So for the third transition, Kevin, what you're going to do is now, from turning your knee into external rotation, I want you to turn your shin inwards. So you hold, yep, perfect. Good. Again, looking at that transition and see if you reach the third position. And then lastly, Kevin, what I'm going to have you do is maintain that shin from turning inwards, and I just want you to bring your knee back down to the ground. Nice and slow and controlled. Good. So those are the 4 different motions that are used to make a CAR. For the knee, now if you were to continue to do the full CAR, we're looking to check quality, and we're going to do this as many times as he can tolerate. What us as a therapist should be looking for to see is if he's keeping the motion slow and controlled. If he has any pain with this, we are going to stop doing this exercise. And for our rep scheme, we're going to go to fatigue. And to see if he is in any fatigue state, we're going to be checking for any compensations that he may be displaying. And then asking him to tell us what he's feeling as he's doing this exercise.
I feel like I'm working really hard.
Doing great.